let's discuss about actinomycosis. And we have classified systemic fungal diseases into four. In that, actinomycosis come under infections caused by filamentous organisms of bacterial dimensions. So, actinomycosis is caused by filamentous gram-positive bacteria that are part of normal oral flora. It is usually present normally in the oral cavity. So that's very important. So the infections are usually endogenous. We have observed that the infection could be exogenous or endogenous. So in case of actinomycosis, it is mainly the infection or the site of infection or the source of infection is from the oral cavity itself. So it is it's a gram-positive bacteria, and it's a part of normal oral flora. It's otherwise called a rare fungus because of its appearance, typical appearance, otherwise called rare fungus. Then it is characterized by chronic, suppurative, fibrosing infection. It is characterized by chronic, suppurative, fibrosing infection with necrosis. That's the main pathological feature. Chronic, suppurative, fibrosing infection with necrosis of tissue. And there is discharge of pus containing characteristic granules called sulfur granules. That's also very important. There is a characteristic granule present in actinomycetes infection. That's called sulfur granules. And there are few organisms few species of actinomycetes. About 70 to 80% of infections are caused by Actinomycetes israeli. Then Actinomyces viscosus, Actinomyces odontolyticus, then this Propionibacterium. All these are the different species coming under Actinomycetes. And so the major organism causing actinomycosis, Actinomyces israeli. About 70 to 80% of infections are caused by Actinomyces israeli. It's a non-sporing, filamentous, branching, anaerobic, non-acid-fast organism. It's a commensal. It's a commensal in the oral cavity, seen in the gingival crevices. Mainly seen in the gums, gingival crevices, plaques, then in tonsillar crypts, etc. And it is unable to invade healthy tissue. These actinomyces are unable to invade healthy tissue. And the typical lesion caused by these actinomyces consists of one or more abscesses. The main feature is presence of one or more abscesses containing dense these microcolonies or colonies containing these sulfur granules. So that's an important feature, pathological feature you get in actinomycosis, this abscess formation and presence of sulfur granules. And these colonies are about 4 millimeter in size, around 4 millimeter in size. And another important feature you get in actinomycosis is formation of fistula. Other than abscess, there is chance of formation of fistulas. That's also an important feature you get in actinomycosis. And can appear in distant places also, other than lungs or lung-related areas. It can affect other areas or very distant areas also. Formation of fistulas. So abscess formation and fistula formation is also an important feature you get in actinomycosis. Then the clinical syndromes caused by actinomycetes, or the clinical classification of actinomycosis. We can divide actinomycosis clinically into four. First of all, cervicofacial actinomycosis. cervicofacial actinomycosis, then thoracic and disseminated actinomycosis, then abdominal or pelvic actinomycosis, and actinomycosis of affecting central nervous system or neurological actinomycosis. Or we can classify actinomycosis into four: uh, cervicofacial actinomycosis, thoracic and disseminated actinomycosis, then abdominal and pelvic actinomycosis, and actinomycosis affecting the central nervous system. Uh, then about cervicofacial actinomycosis, around 50 to 90% of cases of human actinomycosis affect the head and neck. Mainly, it affects the head and neck. Majority of infections come under this cervicofacial actinomycosis. Usually, it follows a dental procedure, or there could be the infection, active actinomycosis infection is preceded by a dental procedure, usually a tooth extraction, or due to poor dental hygiene, then tooth decay, dental abscess, periodontal disease, etc. Then there are two patterns of this cervicofacial actinomycosis. First of all, painless fluctuant or bluish purplish lesion which enlarges slowly, often where the facial artery and the vein crosses the lower border of mandible. This is the common area of cervicofacial actinomycosis. So it could be, first of all, it could be painless lesion, bluish or purplish lesion, fluctuant lesion can be there in the lower mandibular area. So that's the first presentation. Then there can be a painfully separated lesion also, which can appear anywhere in the head or in the neck. It involves the submandibular area of mandible, then parotid region, etc. Then isolated lesions, other than this area, the isolated lesion can happen or can occur in the scalp, then orbit, then the lacrimal glands, middle ear, mustard area, paranasal sinus, then thyroid, or in the trachea. So the typical pathological features will be there, that is abscess formation, sinus or tract formation, all this can happen, all these areas. So that's about cervicofacial actinomycosis. Then about the second clinical presentation, that is the thoracic and disseminated actinomycosis. So here the lung tissue pleura or mediastinal structures are usually involved in this clinical category. It usually follows aspiration of infected material or direct extension from neck or esophagus. So it can be extension from cervicofacial actinomycosis or due to aspiration, or can spread from the retroperitoneal area also, or from abdomen. So these are the possible route of transmission or areas from which the thoracic and disseminated actinomycosis can happen. So usually there could be some chronic lung disease, or there could be a predisposing factor for this systemic fungal disease. There could be some chronic lung disease, and the symptoms include minimum cough, then there could be fever, not severe. Then usually the disease is similar to tuberculosis, or the symptoms are more or less similar to tuberculosis or even carcinoma. And X-ray shows fibrocavitary processes, then loss of volume of lungs, then presence of mass lesion. All this you can see in X-ray. fibrocavitary lesions, loss of volume, then presence of mass lesion, fibrotic lesions in X-ray, then involvement of invading uh, bronchus, lesions involving bronchus, etc. Then another feature you get is this TB and actinomycosis can coexist. Like silicotuberculosis, we have discussed silicotuberculosis. Likewise, this actinomycosis and tuberculosis can coexist. Then there can be discharging sinuses also in case of thoracic or disseminated actinomycosis. Then it can involve uh, other parts of chest also. It can erode the chest wall. It can erode the chest wall. Can affect the ribs, leading to periosteititis, lysis of ribs, lysis of sternum, lysis of shoulder girdle, then etc. These are the important features you get in thoracic actinomycosis. Other than this, it can affect the vertebral column also. It can affect the bony part. The intervertebral spaces are spared. The bony part is affected mainly. There is rarefaction, motile appearance of vertebra, motile appearance of ribs, etc. So these are the features you get in thoracic and disseminated actinomycosis. Then the third category is abdominal or pelvic actinomycosis. Mostly, like in thoracic uh, actinomycosis, here also the infection is preceded by some surgery. For example, laparotomy, operation for appendicitis, diverticular operation for diverticular disease, operation for peptic ulcer disease, cholecystitis, perforating trauma, etc. Then the infection usually begins in the GIT, then spreads to the peritoneal cavity, to the abdominal wall, or extend parasically to the subphrenic area, or can spread to pouch of Douglas, etc. That's a spread of disease from the intestinal tract or gastrointestinal tract. Then sinus tracts are common. I have discussed earlier. The sinus tracts are, or formation of sinus is important here also. Then the lesions are similar to Crohn's disease or the important DD coming in this abdominal or pelvic actinomycosis, Crohn's disease. Then it can mimic malignancy, can mimic intestinal TB, can mimic amebiasis, chronic appendicitis, etc. Or these are the important TDs for actinomycosis. Then there can be hepatic involvement also, involving portal vein, the direct extension via hepatic artery, etc. Then pelvic lesions are also there. In pelvic lesions, the anal area can be affected, leading to sinuses or fistula in the rectal area. Then about the fourth category or the last clinical presentation is actinomycosis affecting the central nervous system. And about 10% of cases, central nervous system is affected. The infection can spread hematogenically from mouth or lungs or from abdomen or from pelvis. And it can lead to meningitis or abscess formation in the brain, then epidural abscess, then compression of vertebral canal, etc. So that's about the clinical presentation or the classification of clinical presentation in actinomycosis. So we can divide clinical presentation into four: cervicofacial actinomycosis, thoracic or disseminative actinomycosis, then abdominal and pelvic actinomycosis, and lastly, actinomycosis affecting the central nervous system. Then about the diagnosis. Diagnosis mainly by clinical features, Then we can advise chest radiograph, routine blood examination. This diagnosis difficult by sputum examination because the organisms are present normally in the oral cavity. Even though we can do sputum examination to rule out other conditions like tuberculosis. Then the presence of sulfur granules in secretion is an important finding or diagnostic point. Sulfur granules in secretions. Then culturing the organism from granules, pus or empyema fluid. Then gram stain shows gram positive center. We can stain the material. It shows gram positive central core and gram negative club shaped or beaded branching mycelia. These are filamentous bacteria. So on staining, gram staining, you get gram positive central core and gram negative club shaped or beaded branching mycelia. And it has the typical appearance is called by the typical appearance is called ray fungus. Ray fungus. Then these are the common diagnostic points you get in actinomycosis. Then regarding treatment, it is treated by high dose of penicillin. Then surgical drainage is usually done. Then body curettage. Then extra growth is removed for body removal. Then debridement. Then radical sinus tract excision or treatment of sinuses is also sinus tract excision is also advised. So these are the management techniques involved in actinomycosis. So that's about actinomycosis.